Hi everyone, this is Dr. K again. Today's Sunday. I wanted to briefly talk about abdominal pain and COVID-19. I received comments on the YouTube channel, and some of the folks over there were complaining that maybe they're having COVID-19, they're not sure, they're having abdominal pain and some diarrhea and so forth. So I want to talk about how COVID-19 can affect your abdomen. So far, CDC did not give any guidance about testing people who purely have stomach-related problems. So we're only testing people who have fever and maybe some shortness of breath, cough, like lung issues. Hey, Lorena, thank you for listening. So we're not testing anybody who comes in purely for abdominal issues. There was a study from Wuhan, China, and they have PCR results on the people who were in the hospital. And they noticed that some people, although a minority, maybe 40% or 30% of people can present with COVID-19 purely with abdominal pain or diarrhea or so forth. So there is a subset of clients who can have COVID-19 and it's only affecting the gut area, it's not affecting the lungs. So, and how can this happen? So we know for sure that COVID-19 can be transmitted through the stool and then through the oral cavity. We know it has been determined so far that it can transmit that way. It doesn't have to be through the droplets, which is the normal transmission. So let's say you get the COVID-19, it's in your saliva, and then it slowly passes down the throat into the food pipe and it goes all the way down to the stomach. Now, I made a different video why some people have less stomach acid than others, and let's say you don't have enough stomach acid that can kill the virus. Then it can pass through into the intestine, and once it's in the intestine, it can go through what is known as ACE2 receptor on the cell and start breaking down each cell and start replicating inside the gut. So that's one well-known mechanism. The normal mechanism, it goes into the lungs as a droplet. It goes through the ACE2 receptor in the cells in the lung and starts destroying the inner lining and starts replicating there. But it can also do the same in the gut. So that's how you can have diarrhea. The diarrhea is a normal response when you have virus. So any virus you have, whether it is flu or cold or anything, you can have diarrhea, and that's the body's response to get rid of the bug. So the body tries to increase the peristalsis, increase the gut movement, and tries to push out as much content as possible. So that's a normal response. I would not recommend taking something like Imodium because it would lock in the infection. So the only things you can do are to support the body using nutrition, hydration, like eating more liquid diet, more soups, things that give you a lot of energy but they don't require a lot of digestion. So those things can help you if you're suffering from these problems. Especially if you think it is COVID-19. And obviously, if you're not getting better, then you may have to go to the hospital to get IV fluids. If you're lucky enough, you may find a nurse or a home health agency that can bring in fluids to the house and do the IV infusion there. We're planning on offering that here in Tampa area. So the other solution is to take high-dose vitamin C. The problem is if you take it orally and if you already have diarrhea, chances are you may not be able to tolerate it because the gut has to absorb it. So the best thing is to take it through the IV if you can find a place that can give IV vitamin C. And lastly, for a lot of my clients, I do energy healing, which I can do remotely, either on the phone or video. So with energy healing, you can reduce the inflammation in the gut and support the body. So those are some of the solutions I would think would help. Obviously, if you're in a situation where you're critical, you have to go to the hospital and get admitted. So that's briefly about COVID-19. I got a lot of questions on YouTube about that. So I wanted to spend some time explaining the pathology, explaining how we can treat it. And although CDC is not giving guidance about that, there are some people who can present with just purely abdominal symptoms. So yeah, so I would venture out and say that you should work on immunity. If you're having any gut issues already, you may be at a higher risk of getting COVID-19 infection. So the ways to improve our gut immunity or gut health in general are to eat fermented foods so that you're supplementing bacteria in the gut. If you don't have access to fermented foods, or if you don't feel like eating, sometimes people don't like the smell and so forth, you can try probiotics. I've been taking probiotics myself for a long time. Lately I'm starting to eat fermented cabbage, and it's available in the store. There's also fermented rutabaga. There are a bunch of vegetables that you can make it yourself. Also, you don't have to buy in the store. You can put them in a jar, put water, and ferment them. There are recipes available to do them, and those bacteria are friendly bacteria, and those will rebuild the gut. Try to avoid taking antibiotics. If you're continuously taking antibiotics, like people who have sinusitis over and over again, that can destroy the friendly bacteria in the gut and make it more susceptible for infections from the outside. So I want to briefly share this. I wanted to explain the pathology and so forth. If you have more questions, comment below. If you want me to make more videos about this particular topic, also comment below. And as always, if you want a private consultation, you can DM me or you can call my number. So I look forward to talking to you guys again on Monday. A lot of exciting things are happening. Probably we'll get some more good news. I know you're getting tired of bad news every day. Hopefully this infection is trending downwards, and then we can get out of the lockout. I think a lot of people are getting bored of this lockout business. Okay, have a nice day. Look forward to talking to you again.